So today I thought I would talk a little bit about ovarian cancer, given that February is Ovarian Cancer Awareness Month. Ovarian cancer is one of those illnesses that perhaps has a little bit less awareness around than something like breast cancer. But did you know that here in Australia, there's an expected 1,815 women who'll be diagnosed with ovarian cancer this year? And it's actually a really difficult cancer to diagnose. So unfortunately, a lot of women are diagnosed quite late in the piece because you often don't get symptoms until the tumour is at a significant size. So just to put it into a little bit of context, 92% of women who get breast cancer will survive a further 5 years or more. That number is actually only 49% for ovarian cancer. So that's more than half of women diagnosed with ovarian cancer will actually die within 5 years of being diagnosed. And it's definitely a cancer that I'm personally very passionate about. The reason the symptoms appear quite late is your ovaries are very small little organs that are buried deep in your pelvis. So you can imagine that if you've already got a small little organ and it grows a little lump on the side of it, you're probably not going to know at all that there's anything wrong. It tends to be whenever the tumour has grown to quite a substantial size that you start to have symptoms. Some of the symptoms that people will present with are feeling full very quickly. So they'll feel like they can only eat a very small amount of food before they just feel like they're so stuffed that they can't eat anymore. Bloating or an increased size in their abdomen or tummy, which they can't put down to having gained weight. Unexplained weight loss is another symptom, probably related to some of the metabolic changes that you get with cancer, but also because of those physical symptoms of not being able to eat as much. Some people will complain of a frequent need to go to the toilet to pass urine. Some people will also get a change in their bowels. Lots of people will complain of tummy pain or pelvic pain, and other women will complain of pain during or after sex and bleeding after sex. Again, a lot of these symptoms overlap with other conditions, so it can be very easy for women to put the symptoms down to other things, which again predisposes us to ending up with that late diagnosis. There are a couple of groups of women at increased risk of ovarian cancer. So lots of people have heard of the BRCA1 and 2 genes, and lots of people know the connection to that and breast cancer, but people carrying those genes have a substantially increased risk of ovarian cancer as well. There's also a group of people called Ashkenazi Jews who have a very high rate of ovarian cancer, again, due to genetics. Obesity, smoking, or other risk factors. Not having any children is a risk factor, and actually not breastfeeding is also a risk factor. Having endometriosis is also a small risk factor, but definitely is a risk factor. Things that decrease your risk of ovarian cancer are things like oral contraceptive pill, having your tubes tied, and obviously being a healthy weight, and breastfeeding. Treatment for ovarian cancer does vary, but obviously before you treat anything, you have to get to the point where you're diagnosing it. As I've already talked about, it can be a little on the late side getting a diagnosis, but that doesn't mean that there aren't lots of treatments. Diagnosis is usually an examination by your GP or your gynecologist, followed by usually a pelvic ultrasound and a blood test looking for a protein called CA125. Now, lots of people want to know why we can't use that blood test, the CA125 test, like we do with cervical screening or mammograms to screen people for ovarian cancer. And in really simple terms, the problem is that in very early ovarian cancer, 50% of women will have a completely normal CA125 test. And so for a screening test to be helpful in the population, it has to be able to accurately pick up people at a very early stage of the disease, or in fact, ideally even before they've actually developed the disease. So this is why we don't use CA125 routinely to check people to see whether they have ovarian cancer or not. So hopefully that makes sense. The other investigations you may well have are a CT scan of abdomen, a PET scan, and if you do have a tumor, you'll maybe have a full body scan, a chest x-ray, just to check the health of all your other organs as well. So after you've had these investigations, one of the hardest things is the wait. Some of the blood tests and investigations, you'll have a result within 1 or 2 days, but some of the other investigations can take a week or more, and that can be a really, really stressful time for people waiting for results. People often describe the waiting as nearly worse than having the result itself. So that's a really tricky time. And if you have a family member or someone waiting, that's time that someone really does need a lot of support and probably quite a lot of distraction. Whenever we think about what treatment is going to occur for ovarian cancer, it does really depend on the type of ovarian cancer. So within the ovaries, there are 3 main cell types, and all of those cell types can develop cancer. Some of those cancers are more common than others, and some of those cancers are more amenable to certain treatments. Surgery does form a big part of treatment for ovarian cancer. It's actually not easy to biopsy an ovary, to be honest. So most of the time they go in, do the surgery, and get the pathology results after they've already removed the ovary. For some women, and particularly younger women, they may remove 1 ovary and 1 fallopian tube and leave the rest. In older women, they'll often go in and remove everything because it's perhaps no longer needed from a fertility perspective. Obviously, your fitness levels, your age and stage is going to really decide what treatments that you're going to have and what you're fit to have. And the average age of diagnosis of ovarian cancer in Australia is 64. It is most common in women over 50 or postmenopausally, but that's not to say we do have a significant group of women who are younger than at diagnosis. The other treatments are chemotherapy. Sometimes people wonder what chemotherapy is. Sometimes it is just a tablet that you take. Sometimes it's drugs that are given intravenously into your vein on a cyclical basis. And basically what they're trying to do is kill rapidly dividing cells. Classically, the chemotherapy used for ovarian cancer are all platinum-based, but there have been a lot of real progressive moves towards other treatments. I should also add that sometimes people have surgery and then chemotherapy, but more recently, sometimes people will have chemotherapy first to try and shrink down the size of their tumor, and then the surgeon will go in and operate at a later stage. So just to talk a little bit about some of the newer treatments, they have lots of different names, but basically they're working and aiming at proteins and the genetics within the cancer cells. And they're sometimes called biological agents. And one of the commonest ones in use at the minute is called a PARP inhibitor. And PARP is a protein in cells that helps cells repair themselves. So every time a cell divides, believe it or not, it can get little mistakes and errors within the DNA. And PARP is something that helps those cancer cells repair. And we obviously don't want that to happen. We know that cancer cells are rapidly dividing cells. They're often making lots of errors. So if we can do something that inhibits that PARP protein from repairing the cell, then hopefully more of those cancer cells will die. So that's kind of the thinking behind that treatment. Another treatment is a cancer vaccine for ovarian cancer that's given to patients to try and prevent recurrence of the cancer. So at this stage, it's not a vaccine that prevents you getting cancer in the first place. It's more used in patients who already have ovarian cancer. And there's lots of other things in trial stages at the minute. But I think like lots of cancers and for example, melanoma research has moved quite dramatically. We're using a lot of biological agents now and seeing dramatically improved survival rates. My hope is that that's the way ovarian cancer is going to move in the future as well. So what can you do to reduce your risk of having ovarian cancer? Well, try and keep within a healthy weight. Don't smoke. Have children and breastfeed. Though all joking aside, obviously some people can't have children and that's not something that they can account for. If you've got a strong family history, explore with your family and with your GP whether you really are someone who should be having genetic testing, Because if that's the case, you really should be having much more regular screening and to just keep an eye and make sure that you're not developing any problems. Hopefully that helps. It shines a little bit of a light on ovarian cancer. That is definitely one that's a little bit less talked about. But again, as I said, February is Ovarian Cancer Awareness Month, and it's such an important cause of premature death and suffering among women. And it would be really fantastic if hopefully even one person benefits from this podcast today. This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or other professional advice. Information is provided for educational and entertainment purposes only. If you have any health concerns, always consult your doctor.